You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, CoolSculpting. It's a way to literally freeze fat, melt fat off your body. And once those fat cells are destroyed, according to my first guest, they don't come back. With us, we have well-known facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, welcome back to the show.
Thanks, Randy. It's good to be here. Only the fat doesn't melt, it freezes.
Okay, so you freeze the fat, but it kind of melts off the body, or melts out of the body?
Well, no, it just naturally, by its own physiology, eliminates the fat cell. It just slowly dies off.
Okay, now you call it CoolSculpt Plus. You kind of are doing the next generation of CoolSculpting.
We are. What we're looking at, we want to always bring the best of practices. So that's one of the reasons that we brought CoolSculpt back. And we're actually not just doing CoolSculpt, we're doing dual sculpting. So we have two machines so that people can do a larger area in half the time if they wish, or they can just do one area, of course. The other thing that we're adding to CoolSculpt is we're doing CoolSculpt plus a thing called Z-Wave.
Okay.
And
what is that?
Well, Z-Wave is basically an instrument that provides sort of a very gentle shock wave, acoustic wave, to massage out the fat after it's frozen.
Okay.
So it both increases the efficacy by around 10%, people think. Now, you know, that can be established a little better. Basically, Z-Wave is approved for cellulite, and we're using it off-label to help get better results with CoolSculpting.
So it helps give like a smoother result.
It gives a faster result and eliminates more fat, is what the evidence so far has shown.
Okay, good. Now, I have a lot of questions, by the way. And you know, we talked on the phone, I'm very skeptical about this. I mean, does this work? I mean, it works.
It really does. And as you know, because we've talked in the past, we've used several different types of fat reduction devices that are all good. But CoolSculpting has gradually developed. The technology remains the same, but they've developed more applicators so they can treat more areas of the body in quicker and better fashion. And adding two machines, dual sculpting, really accelerates that process and gives a better result. So we wanted to bring best practices, you know, to our group of patients. So we're doing the dual sculpting and we're doing the CoolSculpt Plus with the Z-Wave to really give a better result.
Okay, so it does freeze the fat off. Let's start with love handles. How does it work?
Well, basically what you do is you take a device that pulls the love handle up and suctions it into the device, and then very controlled and safe freezing of the fat takes effect. And fat freezes before the skin's damaged because the cells are all on the outside of the fat cell.
Okay.
So the fat can be frozen without damaging the skin or the nerves or any other of the organs in the body. So it's very safe.
So it kills those fat cells? Or some fat cells are killed?
Yes, what it does is it sets off a natural reaction in the fat cell called apoptosis that causes the fat cell to die off, and that happens on about the third day. And we like to accelerate that a little bit with the Z-Wave and massage that out so that the resolution occurs.
The ideal candidates for CoolSculpting are those people that have stubborn pockets of fat that are resistant to diet and exercise. The love handles, muffin top, so-called spare tire, these are the people that really do best with CoolSculpting.
CoolSculpting only took 1 hour. 1 hour, no general anesthesia, no local anesthesia, no pain. 1 hour, in, out, bing, bang, boom, done.
It's been really nice because I feel like I finally have gotten back the body I had 15 years ago when I was in college, and I didn't expect that from the procedure.
After I had CoolSculpting done and saw the results that I had, I've definitely recommended it to a few people, several people at my gym that have the exact same issues. They work out 7 days a week, but there's still some areas that, regardless of how much they work out, it's not gonna go away.
I feel confident in a two-piece bathing suit. I haven't had a two-piece on in years, and I can walk around with it on. I have a form-fitting dress on, and it just slinks off my body. So when I walk down the street, I feel confident, I feel strong, I feel sexy, I feel beautiful. CoolSculpting is probably one of the best things that I've ever done.
I knew that I wasn't going to be able to make it to the gym as often as normal, and I looked into it, and it seemed like the price was reasonable, and it wasn't one of these things that was going to cost so much that I wasn't able to afford. I've had 2 CoolSculpting treatments, and I'm looking to do my 3rd sometime next week. If you decide to do it, I think it's a good investment. I really do.
When you visit the website, the CoolSculpting website, the results are really good. I mean, you could stack those results. I mean, I'm seeing people with love handles and now they're gone. You could stack some of these results against liposuction. And why is it, I mean, for the right candidate, in many cases, it's better than liposuction. Is that true for the right candidate?
Well,
maybe a small area of stubborn fat, like right there, belly button area?
Picking up the right candidate is important for any procedure that we do. So for the right candidate, clearly it's a way to get rid of the fat in a gentle way. There's no downtime. Basically, you can start exercising right away after the treatment. You can go right back to work. So this is a process that is more non-invasive, really, than liposuction would be by a long shot.
So during the treatment, you're awake. It doesn't hurt during the treatment. Is that right?
There can be a few moments of discomfort, but not bad at all.
Now, is this true? Well, it must be. You told me on the phone, but you said that your plan is while they're doing the procedure, they could do other procedures. Like they could do facial procedures, light facial procedures.
Well, this procedure is great for both men and women.
Okay.
So say a woman wanted to do some tightening with Ulthera or EndyMed, or maybe tackle with intensive some of the acne scars that she had that have become worse as things relax, she can do that. In some centers, they're doing hair transplantations at the same time as the CoolSculpting occurs. So somebody can do, a lot of different things because this is a totally non-invasive procedure.
Okay. Now, the goal with this is to freeze the fat, and then you are combining it. That's why you call it CoolSculpt Plus with things like Thermi and this Z-Wave. Why is that so important for better results, in your opinion?
Well, when we add these different type of technologies to CoolSculpting diminishes the fat. We can tighten the skin a little bit, although the natural contraction that occurs with the CoolSculpting can tighten the skin as well. But we can accelerate the process with Z-Wave. There are a lot of different things that we can do to both tighten the skin, change the skin, resculpt the skin, as well as treat with the CoolSculpt.
Now, you always say you have the toughest job in the world, right?
Well, making people happy is our job, and people have to like the way they look. I think that's really important. I think that having people like the way they look is involved with setting their expectations and talking to them about what you can do and what you can't do.
Yeah, because you're dealing with women's self-esteem, men's self-esteem on a weekly, daily basis. So let's talk about that muffin top for a moment. Because you do a lot of facial plastic surgery, and you also do a lot of minimally invasive, non-invasive skin rejuvenation. Do they ever, on your consults, also complain about their fat over the years?
Absolutely, and over the years, at one time in my life, I did a lot of liposuction.
Okay.
Largely don't do any of that anymore, but we do a lot of non-invasive type of treatments to the body. So while we're doing those, the EndyMed, one of the things that we do very often, by the way, is treat liposuction abnormalities.
Okay.
Because if somebody gets liposuction, they can have some waviness. Usually that'll go away, but sometimes it doesn't. So there are different types of treatments, and CoolSculpt actually has off-label some types of treatments that can be good for that, with a flat plate for the belly that is FDA approved.
So if you can grab it with your hands, the fat, this CoolSculpting can work. Is that right? Because it's got to be able to grab it.
It can.
Is that right?
It can.
Okay.
Now, having said that, they've also come out with a flat plate that can do fat that you can't grab in the abdomen and other areas.
Okay, so abdomen, that's the number one spot to flatten out that stomach,
Abdomen,
like after pregnancy?
Flanks, all of those things.
Okay, what about the arms? How well do they treat? I know that's another one of these off-label uses. Tell me about that.
A lot of women like to wear, dresses that bare the arms. And so it's a source of embarrassment. The surgical treatments leave a scar. So using this for the arm is very useful.
So what about bra fat? One of the areas that lipo is good for. Does this work for that?
It does, Randy.
Okay.
It's off-label for this type of treatment, but bra fat is really one of the things that keeps women from wearing the type of clothes that they want.
Okay.
They're not happy when they look in the mirror. So what we want is for them to feel good wearing a t-shirt, wearing a low-cut evening dress, and really feeling good about themselves. So this type of treatment is a non-invasive way to sort of shrink those wings that they have.
Okay.
And make them feel good about looking in the mirror again. Matter of fact, they have a saying that the company uses, fear no mirror.
Okay.
Yeah.
Now you have this speech, and I've had you on the show talking about, especially looking younger, that if you don't like something about yourself, it holds you back in life. Elaborate on that.
Well, basically, one of the things that we'd like to do is produce a very natural type of appearance and restore people to the way that they felt like they used to look.
Okay.
And I think that that's very important. So this is a nice change that occurs without a lot of effort, without keeping people from working out. Because, I have a lot of people that work out a lot and still have these stubborn areas of fat that doesn't go away. And we've had different types of ways to attack this. But this is by far really current practice and really effective.
Okay, now outer thighs. I guess it's approved, FDA cleared for thighs in general, outer thighs. You can do that area as well.
You can.
Because that's a stubborn area for some people. I mean, I know somebody that runs 10 miles a week and they just can't hit that area and they want to do lipo. And I said, well, hey, maybe you need to consider CoolSculpting.
Well, as a matter of fact, that's where dual sculpting really comes in.
Okay.
And using the Z-Wave with this. Because those areas couldn't really be treated, but now the company is clear to do that. And they've developed specific attachments that really make this a very palatable and very effective way to reduce those outer thighs. Women have, what's called a violin deformity, where they'll have flanks and outer thighs, and they'll work out and that'll still be there. That's a distribution of fat that just doesn't go away often, however hard people work out. And the minute that they eat a little more, it comes right back. So what you're doing is eliminating those fat cells and reducing them by about 20% with each treatment that you do. And you can do one treatment for 20% and remove more. So you can bring those flanks in and those thighs in, and women can wear more attractive clothes. Guys can feel better in a swimsuit by taking care of the love handles. So there's a lot of self-esteem improvement and feeling good about the way you look.
Now, when you knew that you were getting this machine and these, did your office get pretty excited about it? Did everybody say, oh my goodness, I got to do this?
Well, the office is excited.
Because it sounds great.
Yeah, I think everybody in the office is having this done, really, without a doubt. Now, we have a couple of people that's not true because they really don't need anything. But yeah, almost
everybody. There's if you're over 35 or over 40, everybody's got a little bit of fat they want to get rid of, right? And you don't want to get liposuction if you only have a little bit of fat, right? And not everybody has the money to take a week off of work, right?
That's true.
For liposuction.
Yeah.
It's very busy. So it's very okay. So the abdomen, the thighs, that muffin top. That if you have fat that you could grab onto, frozen off, and then those fat cells don't come back. So you could do multiple treatments to just keep hitting the area?
You can, and not only is it non-invasive, but it's also really safe.
Okay.
There are problems with liposuction because you're taking off huge volumes of fat. This gently removes the fat, allows it to be metabolized into the body. The fat cells just naturally die out by a process called apoptosis, and it's extremely safe and easy to do.
It's kind of sweeping the country. You think this is the future of fat elimination off the body?
Well, I think the improvement that the company's had make it a best practice now, without a doubt, for fat removal. if you have a lot of fat, liposuction is an alternative. But for the person who really wants to improve their healthy lifestyle and continue, working out or continue walking or whatever it is they do, this can be a really nice treatment for those love handles, those stubborn flanks, the, muffin top that occurs. It really has a wide area of application.
We're going to take a quick break. We come back, more questions about the process, what they could expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I've absolutely worn clothing to cover up problem areas or trick you, camouflage areas that were problematic.
There were some target areas that through working out and or diet that I'd tried to alleviate for years, and that was my love handles. It was very easy because it was just sit there, watch your iPad, watch a movie, can walk right out afterwards and, go back to work that afternoon.
No matter how much I worked out, and sometimes I'd work out 40 hours a week, there's a tiny little bulge that I have at the bottom of my stomach that just never goes away. CoolSculpting seems like the type of procedure that's going to appeal to active, hardworking guys that don't have a lot of time and who would never consider having a treatment like liposuction. So I'm excited about trying this out.
There's some results that were achieved that through all my working out through years and years and years that I was never able to achieve. And it makes me really happy when I look in the mirror. After I had CoolSculpting done and saw the results that I had, I've definitely recommended it to a few people. CoolSculpting is just a great value for the results that you get. Look at this.
I decided to try CoolSculpting myself because there were certain areas on my body that no matter how much exercise and dieting and eating correctly I did, they just weren't moving. There were pockets of pudge that I wanted gone. So far, my CoolSculpting results are great. I just noticed that there's a little bit less to pinch in the area. My clothing fits better. I feel like when I sit down, there's less of a roll.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, freezing fat, unwanted fat, off your body with FDA-cleared CoolSculpting. According to my first guest, it works, it's safe and effective, and for many people, they can avoid liposuction. Dr. Keller, welcome back to the program. Now, of course, it has to be combined with some diet and exercise, but this literally kills the fat cells. And for people just tuning in, give me a recap of what this machine does.
Well, basically, what the machine does is it freezes the fat. You take the applicator and it sucks the fatty area along with the skin up into it.
Okay.
And it freezes the fat, but the skin is absolutely safe.
All right.
It doesn't damage the skin, the cooling's controlled. So it eliminates the fat without doing anything else.
So the fat cells are killed.
They're
or
killed.
It creates like an injury to the fat cells and then they die.
That's exactly right.
Okay.
So they don't come back, the fat cells that are killed, and about 20% of them are killed off with each treatment that you do.
Okay.
So you can really improve the appearance of most areas of fat in the area that are in the areas that are done with liposuction.
Okay.
You can't take as much fat out, but 20% is pretty good for most people.
But you could, with multiple visits, you could get rid of those love handles, right?
You can, and one of our employees, who's going to be doing this procedure, has a lot to reduce. So she's going to do multiple types of treatments because she's never really wanted to do liposuction.
Okay, good. Are you going to give her a discount? 20% off, Dr. Keller?
Easily, but she's really looking forward to it because, it's something that keeps her from wearing the clothes she wants, making her feel good. So it should really help the way that she feels about the way she looks.
And there are a lot of people, because you tell me, you have people come in and they bleed their guts about their insecurities all the time. And you've mentioned that, if it bothers you, now you can do something about it. And there's no excuses because you don't have to take off work. You don't have to, downtime.
It's really great that way.
Okay.
There's no downtime whatsoever. You can go back to working. You can go back to exercising. You can go back to doing most anything that you want. The fat resolves, and we're able to hasten that process of healing and improve the result with the Z-Wave.
Okay, now you call it Cool Sculpt Plus, because what people need to know is not all Cool Sculpting is the same. It depends on the center you go to and how aggressive they're getting with the combination of therapies. And I don't want to put words in your mouth, but is that correct?
Well, basically, we're looking at a couple things, because what we want to do is bring best practices to our patients.
Okay.
And this is one way that we're doing this. We're doing it with dual sculpting. By having two machines to treat areas, we can take care of a larger area quicker if people want to do that. So, you know, you have to realize people, this is something where you come in and you just sit around and basically it freezes the fat. Then with the Z-Wave, we break that up and you're on your way, really, no downtime.
And you do tightening procedures, like if you're doing arms, for example, you would add like one of these other radio frequency or the Z-Wave Pro to that area to get even better results, or no?
You can.
Okay.
You can.
Do you envision doing that more and more?
The Z-Wave Pro will probably do the other things either with or at another time to help tighten it, should that be necessary. So what we have are a lot of options for people to improve on the dual sculpting or cool sculpting procedure.
We're going to take a quick break, and we'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We'll be right back.
Growing up as a classically trained ballet dancer, I'm used to discipline. I'm used to being fit. I'm used to being healthy. With Cool Sculpting, I got the exact results that I wanted. I did a little bit of fat, just a little tiny little fat that no matter what I did, I just couldn't get rid of. And Cool Sculpting let that little bit of extra fat just go away. Bing, bang, boom, done. Loved it.
I had stubborn fat areas that, unless I was able to spend 2 hours a day in the gym, which my work schedule does not allow, this was a much better alternative for me. Cool Sculpting is more appealing to me because it's non-invasive. So after having Cool Sculpting, I was finally able to get rid of my stubborn fat, and now I feel like I did and look like I did when I was in college. I've noticed a lot more definition in my sides when I'm wearing clothes as well as in a bathing suit. I think if people knew the process and how easy it was and how affordable it was, that they would probably consider doing it.
The results that I desired from Cool Sculpting were that I could feel more comfortable in my own body, that I would look better in clothing, that I wouldn't have to necessarily camouflage my flaws anymore. I decided to try Cool Sculpting on my thighs because for me, I'm bottom heavy, and that seems to be a trouble area for me, so I figured if this could help, why not go for it?
With Cool Sculpting, I was able to have the procedure done. It took about 1 hour, just one little hour. I was up to work and I was at the gym the same day. I feel great. I didn't have any downtime. I'm starting to see that nice little waistline appear, so I'm getting that little hourglass effect going on. I really like that. I have not had a two-piece bathing suit on in years, and Cool Sculpting gave me the confidence to go out on the beach in a bikini. I haven't done that in years. I feel strong, I feel powerful, I feel confident. I would recommend it to anybody. I'm healthy and I'm loving what I'm seeing with Cool Sculpting. How cool is that?
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, Cool Sculpting. We're talking about freezing fat today, an alternative to liposuction. With us we have Dr. Gregory Keller. Okay, Dr. Keller. So what's the main benefit, you think, to this?
Well, we want people to look in the mirror and what they see is what they love, basically. It's all about the way they feel about the way they look. A woman wearing a little black dress and showing her arms or thighs or legs, that's really important. Or looking good in the black dress, not having a bulge in the stomach.
So that little pooch, you could flatten it out?
You can.
Okay.
You can. Similar to what you do with liposuction. To look good in clothes is very important to a lot of people, and this can really help. And that goes for men too. You know, those love handles cannot look so great in a swimsuit and really bother a guy.
You can be how old to do this?
Well, there's no limitation on age, as long as you have the right expectations.
Okay, good. And so the patients with this, are they going to be younger and younger, or are they getting younger and younger, or older and older, or just everywhere in between?
Well, I think everybody has some area of fat that they're unhappy with.
Yes.
And basically, that's the indication, it's the result, and we need to consult with people and recommend the best practice for them.
It's less expensive than liposuction, for sure, right? For the love handles, for example.
Well, say you're doing the love handles, Randy. Not only is it less expensive to do it with CoolSculpt to begin with, but also you're not missing work. You know, you're not missing workout. You know, you have a lot of opportunities to keep going in your usual manner and to do whatever you need to do.
So who's the ideal candidate for CoolSculpting? Well, who you'd like to see?
Well, what we'd like to see is somebody who that fat really keeps them back from things. Maybe they don't want to wear a swimsuit at the beach. Maybe, you know, they don't want to wear that dress. Maybe they just don't feel good about that area and look in the mirror and are unhappy with the way they look. So the tagline, "Fear no mirror," you know, really holds, basically. You want to look and be happy with the way you look and appear. So that's the ideal candidate. The person that has that little bit of fat that'll contract and do well is the ideal candidate.
And now in the procedures you do at your office, I mean, you make changes in men and women, and you say their life changes for some of them.
You know, that's really true.
Like they become different.
They do, because confidence is an awful lot. Women, young women, older guys, older women, everybody has something that they don't like, and when they remove that little bit that really holds them back and causes them to look in the mirror and not be happy. Or
I mean, over the years, have you heard people like they got married, they started dating again?
I have.
They got out of a bad relationship.
Of course, you don't want to promise that to anybody, because
but I mean,
that's
but you
not
hear
part
that.
of
But
the
you
procedure.
do hear that in your practice.
We do change some lives. There's no question about it. We don't change every life.
Yeah.
But we do change some lives.
Okay, good. Final message. Somebody watching this, we're out of time. Maybe they've considered liposuction. Maybe they need a second opinion before getting liposuction, or they just hate, you know, fat on their abdomen, their, you know, muffin top area, the thighs. What do you say to them? And they're still skeptical.
What I say is come in and talk to us.
Okay.
We'll consult with you, try and pick out the appropriate thing. We always have your best interests at heart and want to do the best thing for the patient, without a doubt.
Okay, good. Dr. Keller, always a pleasure to have you on the show. I think this is our easiest interview I've ever had with you.
Yeah, thank you, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.